Hey St. Louis, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. Although millions of people in the United States have received COVID-19 vaccinations, there are still some in the community who have expressed reluctance to receive a vaccination once it's available for them. Surveys show that African Americans as a group have expressed concerns about the safety of the vaccines. This distrust is due to years of maltreatment, substandard medical treatment, and exploitation conducted by health systems, medical researchers, academicians, and government. We acknowledge the harms that have been caused by this unacceptable behavior. However, we also recognize that because of these actions and systemic and structural racism, African Americans and other minority populations continue to be disproportionately affected by COVID-19 and have increased risk of severe COVID-19 complications, including death. The City of St. Louis Department of Health would like you to know there continues to be community-wide existence and spread of SARS-CoV-2, the virus that causes COVID-19, in the City of St. Louis, in the metropolitan area, and throughout the world. Currently in St. Louis, there have been 415 confirmed COVID-19 associated deaths as a result of SARS-CoV-2 infection, and more than 19,000 COVID-19 confirmed cases reported. At the onset of the pandemic, the weekly average of daily cases among African Americans increased dramatically from 0.7 to 23.6. African Americans account for almost 60% of all COVID-19 associated deaths, meaning the African American population has had more COVID-19 associated deaths than any other group in the City of St. Louis. The Health Department also wants you to know that although the Pfizer and Moderna vaccines were developed as quickly as possible under a Food and Drug Administration emergency use authorization request, the pharmaceutical companies that developed the medicines followed Food and Drug Administration's procedures for developing COVID-19 prevention vaccines to ensure the safety of the vaccines. The Food and Drug Administration has reported that both the Pfizer and Moderna vaccines have been shown to be safe and effective as determined by data from the manufacturer's findings from large clinical trials. These data demonstrate that the known and potential benefits of the vaccine outweigh the known and potential harms of being infected with SARS-CoV-2, the virus that causes COVID-19. In addition to the Food and Drug Administration reviews and approval of the vaccines, the National Medical Association, a professional society of minority doctors and medical professionals, formed its own review body to vet the data from the pharmaceutical companies and have reviewed and endorsed the emergency use authorization request for both the Moderna and Pfizer-BioNTech vaccines. Also, please be advised the post-vaccination monitoring procedures are in place. To date, the results of these monitoring efforts have not raised any alarming concerns. I personally decided to get the vaccine because I believe it is safe, and most importantly, my parents, siblings, nephews, nieces, and godsons need me to live. As the Acting Director of Health for the City of St. Louis, I want everyone to have the information they need to make informed decisions about the COVID-19 vaccines. To stay up to date on COVID-19 information in the City of St. Louis, please visit stlouis-mo.gov/COVID-19.